Hi, it's Fallon Jordan with Amen University, continuing to share information on PTSD awareness. And today I wanted to share some information about some common PTSD symptoms. So I'm just going to list some of these out and then, as always, give you a little bit of insight based on my experience for myself and then some of our patients. So one is an intense recollection, which can be flashbacks and nightmares of memories. Very substantial and sometimes may not occur for much later in life versus right after the trauma, which is why a lot of people, when they are older and start getting dementia, they start obsessing about the childhood trauma that they had that they never told anybody about. So throughout my journey and clients, if you have experienced trauma, if a lot of the things that I'm sharing with you this month resonate, please know that there is help. There is amazing therapists that have wonderful modalities other than just general talk therapy that can help you heal. And we'll be talking about that the rest of the month, just so you know. So another common symptom of PTSD is actually the opposite, which is an inability to recall certain aspects of something, which is also why it's common with people who have memory problems. When I was doing intakes, I would say, like, when did you start having memory problems? And they'd say, I always had a bad memory. Like, I don't remember my childhood. And when we start asking more questions, we realize that they had verbal, physical, or sexual abuse at a young age. Another symptom is avoiding people, places, or things that are reminders of the event. Car accidents was an example I gave earlier this month. And then I see this a lot with people that were in combat or were a first responder, just not wanting to go to certain places in their town that remind them of certain people. And then certain sounds or smells triggering people who may have been overseas. Next symptom is a refusal to talk about the event, which is one reason why talk therapy tends not to help people that have PTSD, and we'll get to that later this month. And then always being on guard or feeling jumpy, being quick to startle. That was actually something I didn't realize until I started doing my own assessment after my scan revealed a lot of PTSD similarities, that I was always quick to startle. I was a great person to jump out and scare. So thankfully that has been a lot better, and it takes a lot actually for me to get jumpy now that I've been working on that. So super proud of that. And then feeling emotionally numb and detached is a huge symptom. And then sleep issues and then feelings of guilt or shame are extremely common PTSD symptoms, especially for people who were traumatized early in life. It sticks in your brain, in your subconscious brain, when you are hurt before the age of 7 or 8 because of the way the subconscious brain works. And so a lot of people, when they start doing therapy and coaching, they uncover that they have a lot of guilt and shame, that they don't know why they have it. And then we figure out why they have it based on their history, and then we're able to do brain-based therapies to help get rid of it. So looking forward to sharing more about those modalities with you later this month. If you have questions, as always, email us support@amenuniversity.com. Thanks so much, and I look forward to seeing you next week.